Hi, my name is Dr. Hagarty, and I'm here to address a topic that is probably pretty concerning for you right now if you have an injury, and that is when you should be using ice or heat. I know you hear conflicting things from the hospital. Hospital will tell you a lot of times putting heat on it is the best thing right away. The best practice and the most scientific practice for it is to use ice at the beginning. So what I'm going to go through is when you should use ice, how long you should use it for, and when maybe you can start to introduce heat after an injury. So first off, what does ice do? So when you're putting ice on something, you're putting ice on an injury. Let's say that injury is swollen and you're having a lot of pain there. What does it do? It reduces things. So it reduces the blood flow. It reduces the inflammation and the swelling. It also reduces the nerve activity. So you can use ice for several things, but essentially the way I like to think about it is it sort of reduces or shrinks everything around the injury. So a lot of the inflammation goes down, the swelling goes down, the nerve activity goes down. What that means is that the pain level should go down, okay? Now, as far as heat, what does heat do and when should we use it? Heat does the opposite. So think of heat as expansion. And heat, so it increases blood flow, it increases oxygen to the muscles, it increases the muscles themselves and the length of the muscles. So the heat kind of expands everything. Now, general practice, when should you be using heat and ice? I like ice from day one, right from the first day of the injury, up to about day 10. Okay, and that's just to alleviate the pain, get the swelling down. Then from days about 11 through about 30, you can be doing a combination of ice and heat. Okay, so I usually like to start with the heat, finish with ice if you're going to do a combination. And then after 30 days, when things have calmed down and the injury's feeling a little bit better, it's a good time to use heat. And that's when you could be doing that from day 30 on. Now, how long should you do these for when you do them? I would think the best practice and the most simple way to phrase it is 15 minutes of each. So when you do ice, you're gonna do 15 minutes on, wait a little while, let it thaw out, and then put it back on for 15 minutes. And same when you do the heat. So if you're doing a combination, you're gonna do 15 and 15. So anyways, I hope that helps out with some of the misconceptions and some of the rules with ice and heat. And look for us next week as we do another episode of a different topic. And thanks, and you have a nice day.